Hi everyone, thanks so much for joining us today. My name's Ed Smith and I'm the director of the T2D network at the Institute for Health System Transformation and Sustainability, or IHSTS for short. IHSTS is a small BC-based NGO, and for the past several years we've been focused on developing a provincial type 2 diabetes strategy, part of which has been the creation of the T2D network. The network's focused on the prevention, the management and remission from type 2 diabetes, and we're fortunate to have a great bunch of partners nationally that we work with. A core component of the network is education, which is why we're here today. So it brings me great pleasure to introduce Krista Lamb, who's going to be moderating our session today. Krista Lamb is a science communicator who specializes in translating complex topics into interesting and understandable stories for diverse audiences. Krista has been the producer and host of multiple podcasts, including the award-winning Diabetes Canada podcast and How to Talk About Health. In 2025, she received a King Charles III Coronation Medal from the Royal Canadian Institute for Science in recognition of her commitment to fostering science culture in Canada. So with that, I'll hand this back over to Krista, who will introduce our guest for today. Thanks so much.
Oh, welcome to the show. It is really lovely to have you here with me today.
Well, thank you for inviting me.
And so I'm going to let you introduce yourself and tell us a little bit about who you are and what you do.
My name is Jon McGavock. I'm a researcher here at the Children's Hospital Research Institute of Manitoba, born and raised in Manitoba. Love the bison. I'm also a dad. I'm an active cyclist and runner and a passionate member of the diabetes research community here in Canada.
Well, I always love our opportunities to talk about your work. And today I'm particularly excited because we're talking about something we haven't discussed before, which is your work in active transportation. And that's a term that is very academic. So I'll get you to tell us what active transportation means and why it's important enough that we're talking about it for the Type 2 Diabetes Network.
So yes, our work is interested in active transportation. So you getting from where you live to where you work or where you study, outside of your car, let's say. So active transportation could be you walking to the bus, taking the bus, and then walking to your classroom. In the work that we do, we're really focused on active transportation built environment structures. So if you live in Ontario, I apologize for this discussion because it sounds like you're tearing some of these up, but those protected lanes that you see on your roads that keep it safe for cyclists and also for people driving cars, because it separates the two of us, are the things that we're really interested in. Another aspect of that are the trails that you might use in your neighborhood to go for a bike ride with your kids, to get your run in at the end of the day, to go for a walk, to clear your head. So any of those spaces that cities have built to say, here's a spot for you to be physically active, to get to and from work, let's say, and to do it in a safe way so that you're protected from cars.
And that, I think, is a really important thing. And yes, in Ontario, they have definitely been trying to get rid of some of the bike lanes, but not successfully so far. And it's a pretty good cycling situation. And I know in BC, where the Type 2 Diabetes Network is situated, they have a really great cycling network and continue to have so. Really cool. But it's, as you said, it's not just cycling. Excuse me. It's not just cycling. It's all sorts of, movement-based transportation. And I wonder, what have you seen in terms of how this can be helpful for overall health and, of course, type 2 diabetes prevention?
Yeah. And actually, before I get into that, you just reminded me of a really important consideration. One of the elders that we work with on our team, her husband needs a mobility device, and he moves around with this device. And what he's found is actually the bike lanes or the lanes that we're creating for protected spaces for bicycles are actually the preferred way for people with mobility devices to move around the city. So while we call them like active transportation corridors or protected cycling infrastructure, people on mobility devices are feeling a lot safer. They're experiencing more dignity in using these spaces as well. And so maybe we should just call them mobility trails or mobility corridors, because it's allowing multiple forms of transportation through non-car related transportation to get to and from places. And again, it's safely. So how does this fall into diabetes? Well, for us, it's type 2 diabetes. And I'm sure in your podcast, you've done the distinction between type 1 and type 2. So our work has largely focused on mobility for the prevention of type 2 diabetes, let's say. Within our theoretical framework, what we propose is that if you create safe places for people to ride their bikes, for people to walk, for people to run, it'll nudge them away from a more sedentary lifestyle and towards a more active one. So that could be at the end of the day when you're going for a walk with your kids. That could be morning and night when you're trying to get to and from work. In a place like Vancouver, if you can do it safely, you're probably getting there faster. So you may not choose the bike because you're really interested in physical activity. You may be choosing the bike because it's actually just getting you to work, like to and from home, way faster than you would in your congested city with millions of people trying to drive back and forth. And in that framework, if you nudge the population, so large segments of the population, if we just nudge 4, 5, 6% of the population out of their cars onto their bikes, and they're getting a small dose of physical activity every day, we know that physical activity is an ultra powerful behavioral determinant of type 2 diabetes, cardiometabolic risk, longevity. And in addition to that, some of the things that come with it, like mental health, quality of life. So we're really interested in seeing if you build these infrastructures, is it nudging people into that space of physical activity? And then downstream, is it having those health benefits that we're all hoping for?
Yes, as someone who is married to someone who has to take a very long commute to work, he's getting very disappointed that it's almost the end of the biking season in Toronto because it's not quite safe enough yet to bike 15K to his work in icy conditions. But, it makes life so much better and so much easier when the weather is good. But that kind of also leads me into some questions about what are you actually doing? Because I think when people think of research, they think about, test tubes and labs and science-y stuff. But how do you research the impact of these active transportation hubs?
That is a great question. And I think your audience is probably a mixture of people who are interested in health benefits, but there's probably also a lot of scientists. So I'm going to try to do a bit of a deep dive for the scientists who aren't familiar with this kind of work. But I would couch what we do in the framework of causal inference epidemiology. So if epidemiology can be defined broadly as sort of studying people in places over time, we're studying urban populations exposed to new cycling trails. And we're looking at diabetes outcomes or outcomes related to diabetes over time after the installation of these new bike lanes. Within epidemiology, there are 3 different types of research that we could do. I think a lot of people are used to hearing association does not mean causation. And I said specifically at the outset that this is causal inference. So one of the things that we're trying to do is remove that concern of association versus causation by studying natural experiments. So a natural experiment is something where the scientist, myself, does not have control over the experiment that I'm running. So I unfortunately do not have access to $100 million like the city of Edmonton does to install new bike lanes all the way through my city. And if I did, that would be an incredible opportunity for a scientist. However, the incredible opportunity for me is to reach out to the city of Edmonton and say, hey, what you're doing here is probably the biggest health intervention that I'm going to experience in my lifetime. $100 million to facilitate physical activity for hundreds of thousands of people living in your city, right? This natural experiment, if I can design it in the right way, gives me something close to a randomized control trial or a better causal estimate for the effect of those trails on the population, the cities that we're studying, on the health of those people living in those cities. So that's what we're doing. And the causal inference piece comes in the natural experiment. We know what the health of the city looked like before the trails went in. We examine what the change in the health outcomes were after the trails were implemented. And by using some sophisticated and some very simple design elements, we can say, if you live in this neighborhood, we're going to consider you as exposed to the trail and you got the intervention. If you live in a different neighborhood, it's further away, it's harder for you to get to, we're going to say that you're unexposed. And then we can compare what happened to rates of diabetes in the 10 years before that trail went in, and then what happened to rates of diabetes in the 10 years afterwards. Up until now, most people have just said, are people more active or are diabetes rates less frequent in areas that have more trails? And the challenge there, or the non-causal challenge there, is most of the time you either get to choose where you live. So if you're an active person, you might want to move to a neighborhood that has a lot of trails, or you don't have access to where you live. And you are forced to live in neighborhoods where you may not want to live because of structural oppression, because of challenges, economic challenges, racialized challenges that you're facing. And so you're in a neighborhood that's sort of a physical activity desert, if you will. And so the natural experiment allows us to sort of circumvent some of those concerns around the epidemiology of cycling trails and health.
Yeah, and I think you touch on a good point, because where your trail is can have a really big impact, I assume, on whether it gets used. Like if it doesn't feel safe, if it's not well lit, all of those things. So are you factoring in those sort of differentials into the experiment or the equation?
Yeah, what we tried to do, and this I think is a bit of a unique aspect of our lab, is we have access to population level data. So I can get the number of people who are newly diagnosed with diabetes in every neighborhood in Winnipeg, dating back to the 80s all the way up to, last spring. That's phenomenal data. I can map the neighborhoods and link the census to the map and say who's living in the neighborhood, right? Do we have racialized minorities living in that neighborhood? Do we have younger populations, older populations? Do we have higher populations of new immigrants or newcomers to that neighborhood? But where the rubber hits the road for us is we also have counts. We know who's not necessarily who's using it, but we can see the amount of traffic. So how many bikes are going past that trail on an hourly basis. And then the third thing that's really interesting that you touched on is we actually go onto the trails and we do surveys. And we ask people, like, how do you like the lighting? How do you like the safety here? Why are you using it? So with the traffic, we can see which trails are getting a lot of uptake. And with the surveys, we can see why.
Yeah, it's really interesting to me because there's also the idea that if you build it, they will come, which isn't always the case because people might not have access to bikes. People might not know that it's there. So are you working at all with the cities on ways to improve interest and uptake, or is that something down the road that you might be considering doing?
We are doing a very cool project with Indigenous communities on increasing access, which maybe we can touch on later. So let's hold on to that, and you'll have to remind me to come back to it. But just to your point, and I just want to tell you how important that point is that you just brought up about if you build it, will they use it? And so let's use a Winnipeg example, but also a Vancouver example, because I know this podcast is kind of generated from Vancouver. If you're going along the seawall, for example, or if you're riding your bike along a trail that takes you into downtown Vancouver and past the Science Expo, whatever that's called, okay? Those two trails will probably see 6, 7, 8,000 cyclists in a day. However, if you're on the protected bike lane that takes you from Stanley Park up to the hospital or up to downtown, you might only see 100 cyclists. And in Winnipeg, on the north side of town, we have some big, beautiful trails, in a Trumpy term, big, beautiful trails. They go a long way. They connect to schools, and we're seeing like 10, 12 people on it a day. And then we have other corridors that are on the south end of town that are seeing 1,000 cyclists a day. And so we're really trying to figure out, like, what is it about those trails that's causing this diversity, right? And the advantage is we have the counters on the trails, and they tell us, like, this trail is just not being used, and this other one isn't. So one of the things that we're doing that I think people might be interested in, because CIHR is investing heavily in that, is doing implementation science in conjunction with our causal inference. So we are working with cities to say, like, what did you guys do on this trail? Because everyone's using it. And not only are they using it, they're using it for active transportation. We can see on a daily basis, there's a surge in the morning, there's a surge in the afternoon. And then on this other trail, we're seeing nothing. And there's got to be something that you did. And so on the implementation side, like, did you consult with the community before it went in there? That's probably our biggest one. Was there something about this trail that maybe it went in because there was money, it was a rush. You could put it in and you didn't want to miss the opportunity. So you put it in, but you didn't factor in all of these other things that influence why the trail is used. The biggest one that I think anyone who rides a bike, your husband's going to talk about this. Does it actually connect me to anything? Right? Like, is this just going to dump me off on an 8-lane highway and then I'm stuck and I can't go anywhere? And that's what, everyone's really interested in that. But because we're working across multiple cities, there's also some super unique cultural factors that we're trying to explore. So we have areas that have high proportion of newcomers who are not using the trails for cycling. They are using the trails for walking in the evening. But for some reason in that culture, we haven't made it so that they see themselves on these trails. We haven't incorporated them into the planning of these. We haven't adopted them to meet their needs, right? And so there's some disconnect there that we really want to dive into. So that is super interesting, because not only are we going to get the causal effects on diabetes, but then we can give data back to the planners to say, actually, you know what? If you do this, this, and this trail is actually going to get way more use. And Rob Ford's not going to walk around saying we should tear these up because no one's using them, right? So that's a really unique aspect of it. I'm not very well trained in implementation science, so we needed a really diverse group of people to come in and help us with that part of the study.
Yeah, and I do want to go back to what we were talking about with the Indigenous project that you were doing, because I think one of the things that is always of interest to me is access, because if people don't have access to bikes easily, if they don't have access to forms of active transportation, they're way less likely to use them.
Right. And we just completed surveillance on about 30 trails in 6 cities across Canada. And the inequities are pretty much what you'd expect. So who's using them? Guys like me. We learned a term this year at our annual summit, mammals. I didn't know it existed, but middle-aged men in Lycra. Okay, that's who we're designing the trails for. And actually, if you look at the city planning teams, they're mostly men, they're mostly white, and they mostly ride their bikes. So they're excited about it because they know they would use it. But those structurally oppressed, racialized groups, they're not using it. They don't see themselves on those trails. So in the survey data that we had this summer, we had very low rates of uptake from Indigenous populations, very low rates from members of the newcomer communities, people who identify as Black or other people of color were not, relative to the population in the neighborhood, there was a huge disparity there. So on and women too, like either it's safety or when we did our annual summit here in Winnipeg and we went for bike rides just to kind of tour the city and see the strengths and weaknesses. And I had never experienced this or I'd never seen it because I'm a mammal. But when we're out there with 40 people who are diverse in their body sizes and their athletic ability and in their comfort on a bike, those guys ripping past on the trails at, high speeds, it's violent, like it's threatening, right? And so I could see if you're not comfortable out there and you're going to run into these jerks, and it's changed my behavior on a bike, right? You're not going to feel comfortable. So that's a huge safety factor, I think, that we need to build in.
Yes, as a former runner who is always considering getting back into running, but remembers what it was like to run as a woman, I can tell you that it's just as scary on a bike as it is when you're the person running. So I can see why there might be those disparities.
And with the e-bikes coming out and people are riding even faster, it's something really important. It's way more important than lighting. Like it's way more important than personal safety from being attacked. It's like safety from other cyclists and safety from e-bikes or other forms of micromobility. But back to the Indigenous aspect of this, being in Winnipeg and being at the center of truth and reconciliation, and knowing that the disparities were there, and and one of the key things about all this research is we engage the community in co-designing this, right? So you're part of Diabetes Action Canada, where we commit ourselves to patient engagement. We're engaging city planners in the work, people that represent Indigenous community in each city, or people that represent structurally marginalized groups to say, like, how can we get the message back to the city that things need to change? And so with the Indigenous Community Project, one of the things is you can build it, but they won't come if they don't see themselves there, especially if they see this as like a trail to get white people through their community. And so we got funded by CHR to, in addition to the causal work and the implementation work, to run weekend events that highlight the history of the place, that highlight Indigenous traditional teachings for the First Nation and Métis groups that live in the cities where we're studying, that highlight seasonal ceremonies and highlight land-based activities that were common pre-contact, pre-settler arrival. And so we're trying to encourage people to come to the trails, to learn about culture that maybe they aren't learning in other spaces, as a group to feel like they can see themselves there, and to spur on the city planners and others and policymakers to bring placemaking to those places, to recognize the history of those places. What did it mean for a Dakota community to live here, to thrive here before colonial contact, right? And to learn about the Dakota culture if we're in Brandon, Manitoba, or to learn about the Anishinaabe and Métis culture here in Winnipeg. And so these events, we're going to start them in 2026, and they're going to be seasonal, and they're going to move with the equinox or the solstice. So during traditional ceremonial times, we're going to host these events, bring people out, make them feel like they can see themselves in these places. And hopefully we can start to reduce some of those inequities by changing the culture of those places so that people feel comfortable there.
I love that, because if you don't feel like you belong, you're very much not likely to participate. I'm going to circle back briefly because you brought up something that I had on my list of things to ask you about, which was about the advent of e-bikes and e-scooters. And I know in my community, I walk everywhere. I haven't had any job I couldn't walk to in the last 20 years. I'm a huge proponent. But the e-bikes and and not the mobility devices. I want to be very clear. This is the whipping through with your Uber Eats order at a really ridiculous rate of speed. How can we navigate these sort of technologies and wanting to increase the amount of transportation when sometimes the new technologies are making you feel a little less safe?
It is interesting, and we do need a plan for this. And I think if we approach all of our questions first through like a critical lens, where we see the benefit when we're doing surveys. So let's think about the positive effects first. The critical lens is there are huge groups of people that are unable to ride their bike, either due to, they're coming back from a heart attack, which I heard, multiple times this year on surveys. We do work in Sherbrooke. I don't know if you've ever been to Sherbrooke, Quebec. I have a hard time as a competitive cyclist riding my bike to go visit Andre Carpenter's lab because the hills are so steep, right? So like Andre himself is saying, I got an e-bike this year so that I could ride to the hospital. It's crazy. And what we hear from people in those cities where there is a lot of elevation, the e-bikes have changed their life and it's enabled them to be more active. So first and foremost, it is a really important tool in terms of equitable access to physical activity. So I fully support it. And talking to people in those spaces, they love them. It's when they're in the wrong hands, right? And I have seen these guys, I see like the same guy every day ripping through the trail at 40K an hour, and it drives me crazy. And I think we need a sense of, overall in our community, a sense of responsibility. Like, what is your responsibility when you're out on that trail? It's to not threaten the lives of anyone else because your bike is moving fast. And it's just general respect. So whether we're going to have to come in with, cycling-based traffic tickets, right, for these people that are driving recklessly on the trails, or we have to come up with some other kind of speed reducing mechanism, the same way that we're reducing speeds to 30K an hour around schools by putting up devices that, if you turn this corner at a fast speed or you drop this hill at a fast speed, there's going to be a bump there and you're going to go flying. We're going to have to come up with those solutions because they're rapidly evolving. I think Vancouver is probably where we're going to have to turn because, we also work with the Capital Region District around Victoria. That's where it's going to, we're going to see the movement there first. So whatever they learn in their area as these start to explode. And yeah, I was taking my son for a ride through Vancouver, and the number of Uber scooters was crazy. And those things go like 45K an hour. That was our biggest source that was our biggest safety concern riding through Vancouver, was actually the Uber Eats e-scooters. So I think as the number of people moving into those spaces grows, we're going to have to figure out what those policies look like. And I think one of the easiest things will be some speed reducing elements of each cycling infrastructure, just to make sure that everyone's traveling at a safe speed.
Yeah, exactly. Because I think you make really good points. It's not that the technologies are bad. They actually have really great implications. And I think it's wonderful that they've, in many ways, allowed for another economy to come about and for people to have jobs and to be able to do this. But it's just the safety aspect as we try and make active transportation more of a thing that people feel comfortable doing. We're really going to all have to learn to share the road. And that's, we always think it's the cars that are going to be the scariest, but oftentimes it's not. So I think that's a really good point. And so as this conversation, I can't believe it's already almost over. Time goes so quickly when we're having these chats. I wanted to ask the last question I ask of everyone, which is there anything that I have missed today that you think would be important for the listeners and the watchers of this show to know about your work?
I think one of the most important parts of our work that I don't think people appreciate is that we work in huge silos in urban environments. And if you work with a city planner and someone's been trained as an engineer and their main job is traffic, they think traffic. And if you told them, like, your budget for traffic is 100 times higher than the public health budget for preventive medicine, right? Or like, we want to prevent diabetes. We want to prevent obesity. We want to prevent cardiometabolic risk. We have to break down that silo, and we have to work with city planners, and we have to bring them into the conversation. And so my biggest, the proudest part of the work that we do, I had a meeting with the PhD student lab yesterday about, like, what do we have to do? What are our priorities for the next summit? It's listening to, learning from, and engaging with people who work in urban environments that are reshaping our cities, and work with them to say, like, you guys have the biggest potential health impact of anyone, right? Like, more so than the federal government. Right? Like, you're reshaping our environment. So can we work together, optimize the money that you're spending, optimize the work that you're doing, and think about, how can I make the city healthier with what I'm doing? Not just think about traffic. So the one thing that we noticed, we have our research day this year, and Nika Claprad, who's a PhD student in my lab, is looking at mental health outcomes and trails in Winnipeg. And one of the biggest findings from her geospatial mapping study, of the trails that we've put in, less than 3% are connected to schools. City planners are not thinking about kids. Kids riding to schools is abysmal. It's about like 3% of kids actively commute to school on a bike. And it's because we aren't creating safe spaces. If you look at the active transportation plans in cities, they don't include active safe transport to school. Like, they're not, or they don't all do that. So what we need to do is, again, if you're thinking about health and you're thinking about everyone's health, you would say to yourself, well, maybe I have kids, or, my brother or sister has kids. How can we make sure that our investment is going to benefit those kids as well? And that we're thinking about the potential health impacts of our work, not just getting the mammals from their house to their workspace.
Yeah, that is a really important point to end on. And I want to thank you so much for having this conversation with us today and for taking the time to do this. For those who are watching or listening who want more information, the Type 2 Diabetes Network is available to you at t2dnetwork.ca, and we'll put that in the show notes as well. And if you want more information, we'll put some information about how you can learn more about Dr. McGavock's work in the show notes. So thank you so much for joining us.
Thank you, Krista, for inviting me and for doing the amazing work that you do. Can't wait to see you at the next conference and look forward to hearing your next podcast. So thanks again.
Thank you, Jon.